In this video, I'm going to be covering a big problem for low back, hamstring, and sciatica-like presentations that's missed by the majority of practitioners, a sciatic nerve entrapment at the deep hip external rotators. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. Nerve entrapments, they're a really, really big deal. The thing about nerves are they have to make their way through muscles, tendons, around the bones, through the fascia, and they have a long way to go throughout the body. And nerves are built with about 15% of extra slack, like a rubber band. But over time, with bad posture, injuries, overuse, the muscles around the nerves develop a lot of scar tissue. When the scar tissue happens, it actually lays down this glue in there, and then the nerves start to get stuck. Now, when the nerves get stuck, it presents with symptoms like numbness, aching, burning, and tension. But another really big problem happens is when the nerve is exposed or entrapped, what happens is all the muscles around there, they really tighten up even more to protect the area, because if the nervous system doesn't work, you don't work. And one of the most common and most missed problems when it comes to a sciatica-like presentation is actually the sciatic nerve getting caught really deep in the external rotators of the hip, not the piriformis, but actually deeper in the gemellus muscle. So in this week's breakdown, what I want to do is I want to cover a couple different aspects of this. In the first video, I'm going to take a clip from one of our online training modules going into exactly what the symptoms and the presentation is if you have a nerve entrapment, especially of the sciatic nerve. So I'm going to link that video up first.
Nerve. There are 256 different places in the body where nerve entrapment can occur. They're very common. They're often missed because I talk about this. Nerves basically have to start at the spine and make their way through the rest of the body. They're built with like 15% of extra slack in the nerve itself to kind of keep it healthy. But over time, the nerves get stuck around the muscles, around the fascia, and it grabs on that nerve. It gives like that pinching type of feel. But a lot of times, this gives me an idea if I'm having a nerve problem is like where they feel it. If the nerve is getting compromised, it has a very predictable distribution of where it goes. They'll describe it as like a numb, achy, burning, tension type of feel. It does feel worse when they actually use it. It feels better when they don't use it. Common areas where I'm going to find nerve entrapments for low back pain is really going to be in the sciatic nerve. And there's two areas where the sciatic nerve gets compromised. The most common is the sciatic nerve at the external hip rotators. It's not the piriformis, it's actually the deeper ones like the superior gemellus. And what happens is that nerve sits right over top and passes through there. And when we sit on it, it creates some pressure, creates some tension, scar tissue forms, and that nerve gets stuck. I also see it on its way down as it goes through the hamstrings. It can get caught on the lateral side in biceps femoris, but also caught on the medial side in semitendinosus, semimembranosus. I also will see a nerve entrapment on the front, not as common, but I'll see what's called the lateral femoral cutaneous nerve, and it actually gets caught in the hip flexors as it comes out. A lot of times I see that with people that sit a lot, maybe they've had some trauma, and that will kind of present with like some of that like more like numbness and tingling, not as painful down the leg, but nerve entrapments are very key in low back pain.
In that video, you want to be sure to start thinking critically and collecting data and really know where to go. You know, so much treatment is just like a shotgun approach, try a bunch of stuff and not really know what happens. And then you can't figure out the problem if you don't know what it is in the first place. In this next video, what I'm going to show is a very detailed and functional based palpation so you can know exactly where that nerve is getting caught so you can go in there and fix it, because if you can't find it, you can't fix it in the first place.
What we want to do is we want to palpate it under a little bit of tension. So I'm going to bring their leg over just like that, and it's going to set down just like that. So right about just a little bit, just below 90 degrees. That kind of opens that up. It becomes nice and relaxed. And for this one, is it okay if I roll these up just a little bit? So we want to roll these up just a little bit to expose the hip and the sciatic nerve. So always ask, just be nice. So for this one, what we're going to do is roll this up just a little bit. Just like that, and that's going to expose this area. So it's going to expose this area. So once again, I love landmarks, right? Landmarks tell us where to go, specifically big bony landmarks in there. So in order to find the sciatic nerve, what I find first is the trochanter. Right there, it's that big bone, you can't miss it. Then on the back part here is the lateral part of the trochanter. So see, I go big bone, then the smaller bone, and then what I can do is I sink right into this space. And that space right here is where I sink in. This is where the hip capsule lives, right up against the bone in there. That's something we treat in the hip functional test. So that I kind of sink in, and that's the capsule. Now to find the sciatic nerve, what I need to do is bow my hand around, and what that does is allows me to go in and feel on that sciatic nerve. And we're gonna do what's called, we're gonna get the depth, and then I'm gonna bow it. So what we should see is when this is caught, is it not bowing where it should? So right up here, that's all piriformis. It's a little thicker in there, and then gemellus is deep. So a lot of people treat on piriformis, but that sciatic nerve runs right here, and where she's caught is right in through here, and you can see how it's tender in there as well. So that little bit of difference makes a huge difference. So here, remember, trochanter, lateral part of the trochanter, and in my training videos, these are all in here, the detailed palpations as we go through. So trochanter, lateral part, space, that's capsule. But now we want to turn that thumb over and here and bow and feel. So when the nerve is caught, it doesn't sway back and forth. So down here, when I'm sinking in, see how I can move that? And it's not as tender, right? But then as I work my way up, right through there, that's like I'm hitting a brick wall right through there. So that's where my scar tissue is going to be, and that's where I'm going to apply the treatment. So I'm going to be treating the sciatic nerve at that area. So take the time to palpate and find it, and open that up. And even if you're first going through and palpating, go in there and draw a little marker on it too, so you have that area to kind of go from there. But once we'll set up the treatment, we're going to go just distant to that and go right into it as well. So
you see in that video, I'm going slow. You go slow so you can go fast. You know, everyone's in such a hurry to just jump right into treatment, and they end up doing too much treatment and not the right amount of treatment. So slowing down and finding it and knowing exactly where you can go is the difference between getting temporary results versus long-lasting results. Now in this last video I'm going to share, this is actually going to show the treatment. So my technique and my system is called manual scar tissue treatment. What we're going to do is get proper depth and then tension, and then have the client go through a full range of motion. That's going to break down and free that sciatic nerve entrapment. So I'm going to link that video up next.
Is we're going to bring this bottom leg back a little bit, so it's kind of parallel, and then this one's just going to drop right here, right along the table. And that's going to be a really good position for palpation and for treatment, and that's going to open that up as well. And the first thing that we want to do is go in and palpate it just like we did before. Always ask, is okay if I roll this up? So we're going to go in through here, and we already marked her earlier. So remember, trochanter, back of trochanter, that sinks into that space. And then as we go in, we're going to go here, depth, bow, depth, bow, depth, bow, and she's caught up right there. So when you're first learning it and getting it, draw a little bit of a dry erase marker on there. So now you know. So that spot's already there. Now, the movement for the client is going to be really, really important. We want them to have their leg down on the table. We don't want it to be up. Like some people will start it here, and when we're up like that, the glute med will kick on and actually kick us off. So when we have it down here on the table, it's nice and relaxed. And the motion for this one is, once I'm ready, she's just going to start to drag her leg up, just like this, nice and free, and right about that motion from where we are. And it's just going to be a very slow, gradual push as we go in there and open it up, and then you'll see me kind of come around here too. So the key here is using your body and your leverage from where you are, and we always want to get that sternum over the top. That's why when we practice our depth and tension, we practice dropping our sternum, because it all correlates in here. So the key here is all in the setup. So very similar, I'm never in a rush. I approach the client like I'm going to get in there, but I'm not trying to go fast. So this one, what we want to do is we want to be able to get our sternum over the top of it. So I'll have her right here, and I'm going to be just slightly behind it. Start your leg right there, because I don't want to have it in between my legs because it's going to get caught. And actually scoot down just a little bit more towards me too. There we go. So we're going to be here and here. So the first thing we're going to do, we're going to come in, trochanter, back of trochanter. This is capsule. We're going to spin that over here, 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 and she's caught right about there. So we're gonna go just inferior to it, like we said, 1/4 of an inch down there. Now, my hand is gonna be just like that. So once you find it, keep your thumb on there and keep it on the space. Where we talked about, once you get the hands lined up, then we get the body lined up. So now we're here, and I'm here, and the first thing that I'm gonna do is we're gonna do that lock and key like we talked about. We're gonna lock that in, just like that, and we're gonna be here. And what I like to do when I get my depth is I have my arms just slightly bent, and the first thing I do is I go right up on my toes, and my depth is a lean in, like that. My secondary depth is going to be a pec push here, and then my tension is going to be a lean away, just like that. And she's going to start to move her leg, and I want to keep my sternum over top of it.
So you're
Keep going until they can go. And I'm keeping my sternum over top. And then what I can do at the end here to help it a little bit more is give it a little bit more pressure through there. And it's going to be really intense, because when the nerve is inflamed there, very good.
And so do you still do like a 3 count? Like 3 count? Like when you hold it?
No, because it's a nerve. So the only thing that we hold deep in there is going to be a ligament, because a ligament just is deeper, so in the capsules anywhere else. When it's just the nerve entrapment, we just go through and get that pass in there. So you notice here, once I put my hand on there and I kept it there, I'm not moving my hand because I've already done that work to do that. So now I can get myself a little bit more set up. So we're gonna get in here and get another pass. And this time I'm not gonna do the push with the pec. I just want you guys to see what my hand would look like as we go in there. So I would get my depth by coming up on my toes, sinking in, be a little bit higher here, and then my tension would be across like that. So go ahead. And it's internal slide because it's coming to me and opening up. And as I'm doing that, that sciatic nerve, I'm holding back the sciatic nerve, and I'm forcing that muscle to go underneath, and that's what frees it up. So here, you'll be able to feel the difference when I can really back it up and get my sternum over the top. It is a lot of good deep focal pressure. Push through that thumb here, and go ahead. And then when it starts getting inflamed, that's already moving better.
Wow.
Good. And now,
So I hope you got something out of those videos, understanding the importance of asking the right questions, being able to find it so you know you're on it every time, and then getting the right type of treatment. Getting proper depth and tension is what actually breaks that down. What I find is a majority of practitioners are way too compressive and they don't get enough tension. You got to get that tension on that area to break it down. And when it frees up, you should see a long-lasting improvement in overall functioning and pain relief. A couple tidbits are just tactics for you. Number one is be a clinician first. Slow down, collect data, then go in there and treat it. Everyone wants to jump right into treatment and not really getting where they need to be, and they're getting lackluster results, never really knowing what's going on. So be a clinician first, ask the right questions, slow down, get the data, then palpate, and then do the treatment last, and really line everything up in a really good way. I always say this as well as I'm training people, you got to go slow to go fast. A lot of people just want to do so much treatment instead of doing the right treatment. And lastly is just the precision and focus and the attention to detail, because a lot of practitioners are very compressive on these nerves, and they might use their elbow, they might press on it too hard, and it might hurt like hell to the client, but it's actually causing more damage in the long run. In the short term, they might feel better, but it's actually going to inflame that nerve even more, and those problems are going to get tight and cause problems again right down the road, and you're going to be back to doing the same thing over and over again. And I always say the definition of insanity is doing the same thing over and over again and expecting a different outcome. So if you like the video, give it a comment, a like, a share. If you got any specific topics you want me to cover, send them in. I'm always happy to do these videos. Go grab our free training. The big part of the free training is getting you in the idea of being a critical thinker, being a clinician, and slowing down and collecting the data and being able to figure out problems. We also have CEU courses available online and in person where you can become a Peak Method certified practitioner and start fixing injuries that other people can't. And lastly, just go out there and be great, slow down, and be that true clinician and give people the care they really need, because the world truly needs it. Appreciate you guys watching. I'll see you on the next one. Bye.